I'm Dr. Alan Brandis of Atlanta Area Psychological Associates. I'd like to talk to you today about adolescent substance abuse problems and how the use of drugs and alcohol during that time of life can interfere with normal developmental tasks. Adolescence is a difficult time for most people. There are a number of things that are supposed to be learned and skills developed during that time of life that eventually will allow someone to be an effective and hopefully happy person in their adult years. But many teenagers experiment with drugs and alcohol during that time of life, and some adults seem to feel like, well, kids will be kids and that's just part of the normal developmental process. But what I see in my clinical practice tells me that for many, many people, the use of drugs and alcohol during that time significantly interferes with learning and development of things, skills and abilities that really set the stage for a successful adult life. Adolescents who present with substance abuse problems have a unique opportunity to address other related issues, because it's rare that someone comes in with just a problem with drugs and alcohol. We want to try to address these issues and help them and their families before drinking and drugging becomes a way of life and essentially a lifestyle choice that they have cemented in. Looking at issues of mood, self-concept, family and peer relationships, and learning issues allows us to help the teen and their family engage in problem solving, addressing areas that trigger the desire to drink and use drugs to escape difficult and painful feelings, which are normal and accompany the skill development that's needed in order to get through adolescence and become a successful adult. Some of the tasks that an adolescent is supposed to accomplish during that difficult time of life include developing cognitively and interpersonally. Of course, cognitive development includes schoolwork and things that you learn there, but it also involves learning to think critically, deal with a variety of sources of information, and also interpersonal skills. You're supposed to be able to learn to listen to other people and really think about what they're saying. You're supposed to be able to pay attention to other people's feelings and reactions towards you. This helps people adjust their tone of voice and their behavior so that they can interface more successfully with other people and develop friendships and long-term relationships. Teens are supposed to learn to cope with frustration, anger, disappointment, other kinds of negative feelings, which is always a part of skill development and trying to accomplish things. No one that I've ever met anyway is always successful in everything that they try. And so learning to cope with failure, frustration, difficulty, maintain your self-esteem, continue making and persisting in efforts to accomplish things is an important task that if you don't learn that task, adulthood is going to be a lot more difficult for you. Teens are supposed to learn to delay gratification in the service of a larger goal. That's part of what you're trying to accomplish when you tell them that they have to do their homework before they get on their game. And they're supposed to eventually learn to do that for themselves by seeing the value of getting their work done first, paying attention to it, doing the best that they can, and then having the reward. Teens are supposed to learn to persist on tasks that are difficult. You're supposed to develop some sort of an internal dialogue that says, well, this is difficult, but I can do it if I persist. You're supposed to learn that it's not a horrible thing to ask for help if you have difficulty. You're supposed to learn to coordinate your efforts with the efforts of other people as part of a learning process. You're supposed to learn interpersonal skills that are very important both for development of long-term friendships, collaborative relationships in a work environment, and also intimate relationship with a partner. You're supposed to learn reciprocity. Reciprocity is a fancy word for give and take, that relationships are supposed to have give and take. You're supposed to listen and care about the feelings of the other person, and they're supposed to listen and care about your feelings too. And you're supposed to learn that you can't always have your way, and sometimes you have to give in, and sometimes you have to take the other person's thoughts and feelings into account. If you're not able to learn to do that, then intimate relationships and even friendships are going to be problematic for you. Teens are supposed to learn to express feelings, not just to express feelings, but also really to identify feeling states inside themselves, then to discern them, and then to be able to express them. Expression of feelings is a way that we help other people understand. It also allows us to engage in problem solving without having to act out in some sort of negative or aggressive way when we have uncomfortable or difficult feelings. Teens are supposed to learn to take appropriate risks socially. For instance, to approach someone that you're attracted to approach someone that you would like to be friends with, to ask for help if you need help. We see a lot of teens who may be struggling in school, but they're afraid to raise their hand and ask a question. These are all things that you're supposed to be able to learn to accomplish so that they make your life easier, and they also help you feel more integrated into the social fabric. Teens are supposed to learn to solve problems, which requires taking a long-term view of things, asking for help, asking for advice if you feel like you need it, getting several points of view perhaps on things, and also to be able to work successfully with authority. Following the rules, working within the system are long-term strategies for being successful. And if you don't learn those skills, you're going to end up feeling that you're in an oppositional or antagonistic relationship with society and with the system. Teens are supposed to develop, or begin the process at least, of developing a stable sense of themselves, understanding their values, understanding their priorities, understanding their sense of where they are in the social network, and understanding their place in organizations like schools, clubs, and other kinds of institutions. The use of drugs or alcohol on a regular basis really can very significantly interfere with the development of those skills and the accomplishment of those tasks. Drug and alcohol use, first of all, encourages hedonism, short-term thinking, and narcissism. These are things that you do solely for your own enjoyment. Not that doing something for your enjoyment is necessarily bad, but part of the problem with drugs and alcohol is there are things that we're really kind of wired to do which are good for ourselves or good for the species. Drugs essentially short-circuit that. They give you pleasure and enjoyment without having to actually accomplish anything other than purchase the drugs or alcohol. So it short-circuits things and disconnects people from the sense of having to work to accomplish things in order to get enjoyment and pleasure. It promotes short-term thinking and impulsive behavior. Being spontaneous can be a good thing sometimes, but being spontaneous all the time is actually irresponsible. And it leads to making bad decisions, and getting in trouble with authority or with not fulfilling obligations and responsibilities, so that you experience negative consequences. Use of drugs and alcohol promotes lying, stealing, and other kinds of deception. Promotes a oppositional or antagonistic kind of relationship with authority, Most teens don't tell their parents or teachers that they're using substances, that they're getting drunk a lot, that they're incorporating these things into their long-term lifestyle. They make excuses for themselves. They may actually rationalize and justify not doing things that they're supposed to do and externalize blame. One of the tenets of the 12-step program for alcoholism is a radical responsibility, taking responsibility for all the things that a person has done in their life. Why is that necessary? Because substance use promotes exactly the opposite, externalizing blame and not taking any responsibility for what happens. Substances interfere with attention and concentration. They interfere with goal-directed behavior, which requires long-term planning and the ability to delay gratification. It reduces your social options and the range of influences that are available to you. Most of the young people that I've seen over the years who have a lot of substance abuse in their life will tell me, well, everybody does it. That's because those are the only people they know and hang around with. It's not true that everybody smokes pot or drinks, but those are the only kids that they know. So it seems to reinforce their lifestyle choice, but it also limits the ability that they may have to be influenced by other kids who may have different kind of values about getting their schoolwork done and respecting authority and so on. Of course, and this is not talked about too much, but ongoing substance abuse problems increase the risk of death, injury, other kinds of problems, addiction, long-term, and of course legal problems. Many parents find out that their teen has a substance abuse problem when there's a DUI or when they're brought home by the police having had some other kind of problem, which is partially related to their use of substances and the poor decisions that they make when they're drunk or high. Substance use encourages an adversarial and oppositional relationship with authority. Most of the time, underage people are not allowed to buy alcohol, and of course they're not allowed to buy substances of abuse. And so they hide and conceal their use, and that breaking of the law and deception really can become a lifestyle. In order to tell if your teen might be having a problem with substance abuse, there are certain signs and symptoms that you can look for. Now, none of these is a certain indicator that there's a substance abuse problem, but if several of these things are happening, and especially if they seem to be happening suddenly when there were different behaviors before, one of the things that you should look for is whether there might be a problem with drugs and alcohol. Changes in dress, hairstyle, peer group, or attitude toward school or toward adults in general can be a sign that there's a substance abuse problem. Secretive behavior, bringing people into their room without introducing them to the parents, not talking about their friends. There are kids who actually are selling drugs to their friends, and so one thing may be very short visits because someone who's coming to buy drugs is only going to stay with you for about 5 minutes. There may be other things that happen, things that seem to be efforts to conceal things, for instance, burning of incense, things that seem to help conceal the effects of drug use can be signs that something's going on. Irresponsible behavior can be one of the signs and symptoms. Making excuses for things, as we talked about before, not taking responsibility, isolating in their room, although that can be a sign of depression or other kinds of problems as well. Negative attitudes towards adults, and as we said, none of these things by itself is creates a certainty that there's a substance abuse problem, but if any of these things are happening, it might be a good idea to take a look, and if you're not sure, it might be a good idea to bring your teen in and have a therapist or a psychologist talk to them, and help sort it out. Because if those things are happening, even if it's not a substance abuse problem, something's probably not right, and your teen may need some help.